welcome. So glad to have you all here. My name is Jenny Ann Chondo, and I am here, as always, to help guide you through another incredible session with another incredible speaker. I'm telling you, the team at SARE just keeps reaching out and getting these people with really, really great information. And so we are able to receive it, learn from them, and then take it into action. So my job here today is just to guide you through the session and make sure that you get the most of it. So the topic today is an interesting one. It's understanding impact health sharing, affordable healthcare for entrepreneurs, small businesses, and individuals. So if you're thinking, oh, I don't have a business, no worries. We're going to talk to you too. We will speak to you too. Our guest today is Jackie Jones. I've enjoyed getting to know her a little bit previous to this. In fact, she even shared a little motivational sort of acronym with me, and I don't know if she'll share it with the group, but she's got a lot to say. She is the owner and president of Global Legacy Solutions, LLC. What is that, you may ask? I asked the same thing. It is a residential business, internet, payment processing, security, healthcare. They do it all, really. I know that the focus today is on healthcare, but this is a business that provides all of your essential services for either your business or your residents. So she'll get more into that, but I just think it's important to know where speakers are coming from so that you know that they really have the knowledge and the wherewithal to dispel the information. She has more than 30 years of dedication to the mortgage industry. And so what she did in that capacity was assist people into obtaining their dream of home ownership through utilizing down payment assistance by aiding in the knowledge needed to understand all the steps in the process. If you've ever gone through that process, you know. It's a lot. I remember thinking, oh, I've got this when I bought my first home, and I thought, okay, well, there is some terminology I definitely did not know. So it's really important to have individuals, like Jackie there to help us through. She says her heart, soul, and mind has always and will forever be dedicated to delivering, invoking change, and empowering communities from her life experiences and challenges. So this is really a perfect platform for her to really come to the forefront and share her knowledge. Jackie, I am going to let you take it away, but I want to remind everybody before you do that if anything comes up, if there's any kind of question, if you're thinking it, someone else is probably thinking it too. And if they don't have questions, Jackie, don't worry. I will come up with my own questions and we will chat on the back end. But for now, I will let you take it away. Welcome, Jackie.
Great. Thank you, Jenny, so much for those kind words. I want to thank each and every one of you for being here today and reach out to give a heartfelt thank you to SARE National for the opportunity to educate, something that they've been doing for our communities across the United States and more for over 60 years. And again, I just want to thank SARE National from my heart for the opportunity to share. So my goal today is to inform you about an alternative to health care. And my goal is to provide that information as well as give you an opportunity to save on something for your business and provide you the insight for doing so. I'm going to start to share my screen and let's just jump right into this. So again, this is my contact information, but I just wanted to be able to share that with you. Are you seeing my screen okay, Jenny?
We see it great. We see the presenter, Jackie Jones, and then your email and your website.
Okay, thank you.
Yes, rocking and rolling.
All right. So
and I see that you've got 34 unread emails, so you're doing better than me. All right.
Okay, so let's talk about impact health sharing. But before we do, I want to mention some things to you. Uber, Amazon, Airbnb, those are industries disruptors. What did they do? What was so successful about what they accomplished? In our world today, technology trumps everything. Impact health sharing has done the same thing and will be a disruptor to the insurance community. It's an alternative healthcare solution for entrepreneurs, small business owners, and individuals. What do I mean by small business owners? Individuals can be, a small business owner is one individual up to 49 employees, classified by IRS. But let's not get impact health sharing confused with insurance. It's not. It's a community-based sharing model that share in the cost for the whole community and members of the plan. It's been around for 41 years, the concept itself. But what changed with Impact is the patent technology, and definitely will make it a healthcare disruptor. The challenges today, we already know with healthcare that it is costly. So we have, with Impact Health Sharing, a model that is very innovative. It addresses the gaps in the current healthcare system and uses a unique approach. And you say, what might that be? It's affordable. It eliminates the full burden, medical burden of expenses for the impact of, to impact the community and the customers within the group. It offers cost-effective alternatives to the traditional insurance. And you say, how might that be? I'm going to knock you off your seat when I tell you that there's no network restrictions. What does that mean? That you can go to any hospital, any doctor or specialist that you desire in your town or when you're traveling. See, we don't have to go to a page or to find out how or if a person is in a network, whether that's a doctor or a specialist. You are allowed as a member to choose who you would like to get your service from. What does that provide? Flexibility and autonomy for the healthcare decision that you have to make. You don't have to sacrifice your health because you cannot afford it. It's a reference-based repricing system. That's the technology behind it. It's innovative because it will cut the cost of your healthcare. I usually will say, I don't guarantee anything, but for most individuals, it will save anywhere from 30 to 50 up to 70% of what you're currently paying, whether that's through a group plan or individual. See, we offer transparency. We offer fair pricing in our medical procedures. So you get to see what you really should have been paying on your medical bills because of the technology behind it. It is awesome. It's comprehensive coverage. You have an opportunity every year to get your annual wellness checkup. So we encourage preventive care and your regular checkups every year. So we focus on maintaining your overall well-being and catching and early detection of any health issues. What additional does it include? It's a comprehensive medical coverage. So it covers a wide range of medical services, including treatments for injuries, accidents, illnesses, and it ensures that you are getting the medical care you need without having a sleepless night worrying about the financial burden that comes with medical bills. Did you know that based off of the information regarding mortgages, late payments, that individuals' medical expenses have caused them to file bankruptcy many times? That is proven throughout history. This eliminates that financial burden. It also includes mental health support. Wouldn't you say that that's a buzzword today? Mental health support. After going through the attacks and also being affected by COVID. Individuals are talking about mental health and what it has done, and it's automatically covered. It is included in the coverage along with the counseling that you would need. It addresses the importance of being alongside having physical good health, not only in your body, but mentally as well. We have unlimited telehealth at no cost. This provides you a convenient access to healthcare professionals via telecommunication. You don't have to leave home to get the medical advice that you need. And however, if you need further assistance, you know that you can go to any doctor or network that offers our coverage. There are some networks that doctors that may tell you, oh, I've never heard of Impact Health Sharing. That's okay. We have a provider ID on the back of our card, just like any other service. All they would need to do is call and find out about Impact and get their provider codes that they need in order to bill you. And here's a little tip I will always tell those offices that tell me that. I say, and guess what? We will get you paid within 15 to 20 days. And they step back and they're like, oh my God, because guess what? In the normal insurance world, they're getting paid 30 days up to 90 days and sometimes longer. I have a nurse that I had been talking with. And you know what? When she saw that, she goes, oh my God, this right here will help a lot of my doctor offices that are dealing with patients. And don't you know, most doctors have been turning down patients based off of the services if the insurance company that they've been working with has not been paying them. What does that leave? Where does that leave that individual? And so it is not just the immediate impact of the services, but also the impact to the community. Oh my goodness, this one touched my heart because, see, my mom will be turning 85 years old, and I now have a backup for her. She has Medicaid Part A and B. That's all that's needed if you're 65 and plus years old. And guess what? Here's the kicker. Pre-existing conditions are covered if you're 65 and over. So we tailor a solution for the retired seniors that are seeking affordable health care. And it is a lot of individuals that literally cannot pay for their medication that they need. That is another service that we provide. We will go with our technology and reduce those medical expenses for all individuals, not just for seniors. And to give you an example, live, a good friend of mine had to have an emergency surgery. And doing that emergency surgery and afterwards, everything came out fine with her, but she had a $21,000 bill at the end of it. And you look at that bill and you're like, oh my God, will I be able to take care of this ever? And yes, she was, because she sent that bill to Impact Health Sharing. Our team reviewed that bill, ran the cost through our system, and guess what she ended up paying? Less than $2,000. That shows you how much our industry has been taking advantage of us when it comes to health costs. See, we address the specific healthcare needs of every individual's, older individuals as well. And it brings peace of mind to individuals to know that they have a backup to the backup, is what I call it. So, Impact Health Sharing offers a revolutionary approach to healthcare. It provides affordable, flexible, comprehensive coverage for individuals and small businesses. And remember, I said small businesses are businesses with 49 employees or less. Or it could be a business that have several LLCs that have employees under each LLC, as long as it does not exceed 49 employees. See, Impact Health Sharing, the reason that it will revolutionize and be an alternative to healthcare, because it empowers the member a choice. It gives them transparency to see what the real costs are. And we can service our community and provide that support. Again, I want to state, it is not insurance. I don't have to be licensed to provide this service to the community. This is going to be a game changer. Transformational healthcare solution for the modern age is what I call Impact Health Sharing. I also want to play a video because I want you to hear directly from the CEO. See, Impact Health Sharing, it's a nonprofit. It's not a for-profit. So we don't have to worry about caring for the shareholders for their dividends. We are all about the community. And I'm going to start my video, and I'll get that started right now.
Hi, I'm Phil Chrysler, President and CEO of Impact Health Sharing. Healthcare sharing began in churches. You were asked to contribute to help Bob and Sue with their ailment. People passed the hat and you contributed what you could to help your fellow member in need. Then, fast forward, you saw great things occurring in the Amish and Mennonite communities doing exactly the same thing. Then it got a little more formalized in the 80s with some religious-based organizations, and then the Affordable Care Act came along. That's really what propelled healthcare sharing to its modern-day growth. You remember, the individual mandate penalized you with a tax if you didn't have health insurance. But if you were a member of certain healthcare sharing organizations, you didn't have to pay that. Now we know the individual mandate has, of course, been reduced to zero. But in the meantime, healthcare sharing grew over 1,000% in the last decade alone. Why? Because it's an alternative to the high cost of insurance. Typically, you'll pay 30 to 50% less. Some reasons why? We're not for profit. So we have no profit motives that typically cause conflict between members, providers, shareholders, and the executive team. None of that exists with healthcare sharing and certainly with Impact. You can stop overpaying, my friends. Here's an important statistic to understand why. Department of Health and Human Services says about 5% of the population account for nearly half of the healthcare spending that occurs in this country. Majority are healthy. They're overpaying, though, for the non-healthy. Insurance has become really no longer affordable. 80% of U.S. adults rate lowering their healthcare costs as their top concern. So why Impact? Well, we're rooted in the Love Thy Neighbor approach, which allows us to welcome all races, all religions, all colors, all creeds. We were the very first healthcare sharing entity to launch this patented technology platform that really provides 100% transparency. This had never been done before in healthcare sharing, certainly not in health insurance. We have member-owned accounts. That way the money stays in your account. We have no network. You get to see any doctor you want. Again, providing full transparency on how all the money moves is something we're really, really proud of. And of course, you have no open enrollment restrictions. Membership begins the first of every month. You just got to finish that application by the last day of the previous month. We also have great pricing and programs for individuals, for families, for seniors, and for groups. And remember, friends, it's a comprehensive program for your health. So we have preventative services, maternity, accident, illness, and of course, injuries. You have access to telemedicine and an industry-leading prescription drug pricing program. Here is a quick video that highlights the opportunity for all of us to be a disruptor in the industry. Enjoy.
Healthcare spending made up 5% of total U.S. GDP in 1960. In 2020, spending hit almost 20%.
National polls show Americans believe healthcare prices and drug costs are among their top pocketbook concerns.
Over the past 20 years, the runaway cost of health insurance has outpaced earnings and inflation, leaving our families with less freedom and less money. Families, small businesses, and individuals alike are struggling to find a way to pay for the health care they can't seem to afford. So how are we going to solve this problem? All over the world, technology is changing the way people and society connect and interact. The result? Countless industries are disrupted. But while the rest of the world has changed, insurance and the way we pay for healthcare remains broken and largely the same. What if there was a way we could all pay for healthcare that simply worked better and felt better than insurance? Well, today there is. We are Impact Health Sharing. We are a network of families, individuals, business owners, and small entrepreneurs who want to see the old way of doing things change. We use technology to connect tens of thousands of individuals and families across the nation to simply share and pay each other's medical bills. Old problems can be solved when people come together to leverage their sense of community with technology to control the cost of healthcare.
My friends, what we are simply doing is leveraging your sense of community with technology to control the cost of healthcare. I hope you'll join us.
Jenny, I'll open it up for questions.
Perfect. And we're still on track with timing, so it's all good. I want to point out to everybody, if you're curious about this or really wanted to get in touch with Jackie, her email is up there, her website's up there. You know, I know you had worked in like the mortgage industry for many decades. How did you find out about health shares? How did you get into that sort of sect of the sort of service world?
So I entered the service world in 2012 with Essential Services. And as we continue, our company just continues to look for opportunities to help the community with really cost savings impact. That is our goal. With everything that someone already has in their budget, we're looking to see how we can help them save and cut costs. And in 2019, Impact Health Sharing, we married that business. And after just looking into it and seeing the opportunity to assist individuals, it was just a give me because, you know, I come, and it's by nature that I'm a servant to the community. And I did that for many years, training and teaching in the mortgage industry. And this was just a walk in the park to be able to provide these services to individuals.
Was there a bit of a learning curve when you first started, or perhaps there still is in terms of teaching people about it and letting them know what it is?
Absolutely. You know, I look back and because I had never heard of health sharing. So me being the researcher that I am, I started doing a lot of research on health sharing and found out that it had been around for over 40 years already. And it's almost like the little hidden nugget that turns into a diamond. This because of the impact that it makes on families' lives. And here's another thing that I just realized, that this will cover not only the employee, but it covers their whole household. So no longer, I saw a way, my husband is a teacher, so in the past, he's retired now, but I saw a way, I've talked to many, many teachers, and the only reason that they work is so that they could get health care. This is an opportunity that they can save and get better health care than what they've been traditionally given. And removes the sunglasses from the cost. It removes that it's affordable, and families are truly being impacted every day by just they're getting a quote and they're floored. I have story after story that I could tell you about the savings that families are doing, whether they're currently with insurance like a Blue Cross, Blue Shield, Aetna, or any of those, United Healthcare, any of those services. This actually is so much less. And it's really impactful to me because I know that as far as our industry right now, people are really hurting. And we see it every day. And COVID, of course, did not help that.
So is this something that an employer could offer instead of a traditional Blue Cross Blue Shield or United
Absolutely.
Care or whatever? Okay.
Absolutely. And let me tell you a little story on that. We had a church that wanted to grow their church. They were currently offering elementary education, but they wanted to take it to the 12th grade. And they knew they had to hire more teachers in order to do that. And so they looked at their budget, and Impact Health Sharing came into their life, and they got a quote. They were not only able to pay for each of the teachers' health care, but they also saved $100,000 a year off of what they were paying. So they are elated about the cost. It truly cuts the cost for employers that have under 49 employees.
Right. And that's important to note. And most people that are joining us on these sessions are very small businesses.
Mhm.
So is this something that you would do in addition to one of those healthcare plans or just instead of entirely?
Instead of entirely, because it covers all of the traditional comprehensive health coverage. And it is also covers maternity. And as I mentioned, healthcare, and also not only healthcare itself, but the counseling. And there's also therapies that are covered on our coverage.
Which is actually kind of unusual. A lot of regular coverage doesn't. Do you get to choose your own provider or your own doctor or hospital, or does it depend?
You can go to any provider, any doctor. And if they don't or are not familiar with Impact Health Sharing, all they have to do, you get a card, just like what you would do with your regular insurance companies. There's a provider number. That's what that office is looking for, because that provider number will give them the codes that they need to bill. So once they contact Impact Health Sharing and they deal with Impact, normally, 9 times out of 10, they become a provider, because guess what? They get paid within 2 weeks, 2 to 3 weeks, and that is highly unusual in the industry.
Yeah, usually it takes much longer. That is definitely for sure. Does this cover for big illnesses, or do you need a supplement for that? I'm thinking things like cancer or traumatic brain injury, things like that.
That is a great question, Jenny. Because and that's where it depends. So it does cover, say that you're healthy and you get Impact Health Sharing and you start the program, and God forbid that you get cancer. It's covered fully, 100%. An individual that has had cancer in the past, if they are without cancer for 3 years or more, it's 100% covered. And here's another piece. If they cannot be covered, they can still send their medical costs to be reduced by our technology that we have to help them with that as well.
Okay, gotcha. Now, what's not covered, or what would people go into? I know that it's sort of a nuanced thing there, but is there anything that it's like, okay, we do all of this, but there's this other thing that we don't do?
The answer to that question is just what I explained.
Okay.
If a person have had a heart attack, have had cancer, and they have been healthy for the last 3 years and have gotten a great report, they're covered. However, if they're within that 3-year period, that particular service, that health or heart condition or cancer is not covered, but the medical costs can be reduced related to that. So this is, to me, what makes Impact Health Sharing completely different than our traditional insurances, because we know that that would be a flat out denial across the board for our current insurance industry.
Are there things like copays in this scenario?
There is a copay that is related to the service. And that is where I said that comes a specialized, because it depends on the number of members. But guess what? Any family, it covers one individual, two individuals, or 3+ individuals. It also covers anyone that is employed, self-employed, unemployed, and I-10. So it covers an array of individuals, and it gives them, like I said, the affordability for healthcare. We are trying to make sure that we can catch as many people as possible with this Impact Health Sharing.
Are you seeing a lot of people who perhaps stepped away from a traditional job? You referenced teachers and your husband being a teacher, to do more of like start their own business, or perhaps do a job where it's like their business is just themselves. They are a public speaker, or they are a photographer, or they are a doula or a midwife, or something where they're the only employee. And so then they're doing this for their health insurance for themselves.
Yes, absolutely. Actually had a young lady that started her own hair salon. And of course, she didn't have any employees, it's just herself. But she started her hair salon, and knowing that she had the peace of mind of getting coverage that she could afford, it was just a relief. But here's the kicker: her whole family is covered, not just her. Just think about that. Many spouses go to work just to pay insurance. And when your family is quoted, it's the whole family that's covered. So that employee that has the wife or the husband working, and they get Impact Health Sharing, guess what? Now that person can really come home, because it's going to be reduced. 9 times out of 10, we're able to save individuals hundreds of dollars per month on their health care.
That's a huge impact for a family. That's really, yeah, that's a huge deal. Now, we've talked about who this is for. We've talked about some of the benefits. Who is this not for? Who would this not make sense for?
Chronically ill individuals that 20%, that 80% of us are paying for health insurance for in the past. That's what it's not for. But the good thing is that they can always get their medical costs run through our system and reduced. That's the great thing about it.
So they can still be members. It just might be they're paying more than others because they do have this condition that is going to cost the group some money.
Yeah, well, they can be members. It's just whatever that chronic disease or chronic situation is will not be covered. So
Gotcha.
Let's say that a person had a heart attack. They're out there within that 3 years, but later on they get cancer. The cancer is covered.
Got
It's
it.
just the heart disease is not covered.
So then in that instance, would that person have a separate insurance for I forget which we said was first, the heart or the cancer? Would they have another insurance for that, or pay cash, or would it, I guess it would just be up to them?
That would be up to them. The great thing about that is when an individual call and they get a quote for our services, they are actually going to be scheduled with an individual that will go over their medical history and tell them right up front, here's what is covered and here's what's not going to be covered based off of that scenario that we just gave. So they can go in the door, open eyes, full effect, knowing what would be covered, and just prepare for that. Oh, and here's another nugget that I wanted to throw out there. Have anyone ever paid for insurance and you left that employer? You had insurance coverage with the employer, you left, and you were paying for insurance. Guess what happens with Impact? If you change employers, you carry your Impact Health coverage with you. And so any monies that you've paid in it, or you decide, hey, I just don't want Impact Health Sharing anymore, and you've been paying in it for 3 years, guess what? If you have not used those funds up in your account that you see every month going in, you get a check from Impact Health Sharing on the 91st day after leaving Impact Health Sharing. It's almost, I tell families, it's almost like a savings account. If you need those funds, you can retrieve those funds. I have worked at several major corporations and have been paying into their insurance for years, and I never got a check after I left.
That is true. That is very, very true. That I was thinking the same. I've moved jobs many times and then worked for myself many times, and it just kind of cuts off, and you do that really expensive COBRA or
Yes.
hope that a spouse has something and that you're able to, there's those certain life events. With
Yeah.
this, is there the open enrollment type period? Is it like that, or could somebody jump on right now? How does that work?
Jenny, you are asking some great questions. I love it. So with enrollment, guess what? An individual starts their Impact Health Sharing today. Guess when their coverage will start? April 1st. It starts the following month. That is awesome to me.
Well,
And a
okay.
lot of things I didn't put in the presentation because I would have been mentioning these things. That's why I said you got great questions. You're reading my notes.
Well, and some of it's stuff that you did go over in the presentation, but we want to just like pull even more out of you, and because all of us watching right now, we're not professionals in the healthcare industry. Well, I don't want to speak for them; they may be, but I know for myself, it's just you're just a regular person out there in the world. We got a good question coming in from somebody saying that she knows someone who actually there is health insurance through her employer, but she cannot afford it. She goes through Parkland for healthcare, and this is kind of specific. So they're wondering if Impact Health Sharing could benefit her.
I would say 99.9% yes. The key is that there's a complimentary quote that actually comes up automatically, and I usually walk people through that. It's very simple. We only need 2 pieces of information: how many individuals in your household and the oldest person in the household birthday. And that's it. There's no credit check, no background check, or anything of that nature. It's only those 2 pieces of information. The screen will populate with the cost. And you, just like in the insurance world, we call it a primary responsibility amount, the same as a deductible. Ours start at $2,500 and goes all the way to $10,000. So for a person that is in that situation, I would say start with the $2,500, because if you're not using it, by the time that you may have an opportunity to use that, you'll already have built up your account, and you see your account on a daily basis, monthly basis, what you have put in. Because see, all of the money that you're paying in, you see that every month. And you get your own website to go into, and you can look at it and know that you're really kind of saving for that unspeakable time or event in your life. So yes, I would say 99.9% yes, definitely save money.
Okay, great. That's great to know, and I guess they can reach out to get specifics and things like that.
Absolutely.
Is there I was just kind of thinking through some scenarios for business owners.
Mhm.
How does this work if somebody has a traditional, if they're offering that small business that meets your requirements and they are going through a traditional health insurance carrier? What's the transition process like to do something like health sharing in their business?
Perfect. So they, I'm sure, to be used to what is called, it's like, I call it, to put it in simple terms, like a big Excel spreadsheet. And it has all of the employees' information that is necessary, just like you would do with an insurance carrier. And then they would send that to our contact at Impact. They would get a quote for each employee. That after getting a quote for each employee, our impact group would come out, have a call, or come out and meet with those individuals, and then go over all of the coverages, go over all of the information, just like what would happen in your traditional insurance world. And then the business would get a quote on how much their savings, because we like to compare what they're currently doing against Impact, and it builds stories, right? And success stories. And so they would get that information, and then they would get started on a given date. They would say, okay, we're going to go live with Impact Health Sharing this date. And all of that's determined in the background with our team.
And then do the employers sometimes cover some of that, just like they would with a traditional healthcare plan? I know sometimes they do, sometimes they don't. Depends on where you work.
Exactly. Yes, that we offer that as well. And what we're finding is that those traditional businesses with employees, their savings are so great. We had a business where the business actually, they were paying for the employees through their traditional insurance, got a quote with Impact Health Sharing, and was able to, the amount that employee was paying every month, they were able to give them a check back because they saved so much. Close to $400 went back to those employees. Just imagine that. Just imagine getting that type of incentive from your employer. What does that do for the employee? It definitely strengthens their benefit package, right?
No, for
For
sure.
the employees.
How are you able to do it less expensive? Why, not why, but how are you able to be that much cheaper?
You know what? When I did research on how much money, the trillions of dollars in the insurance industry for years have been, that we've all been contributing to, and I look at Impact, Impact is a nonprofit. All of their costs is only associated with giving back. So, give you for instance, last year, Impact, because they had members coming in, because see, we're all across the 50 states and countries. So they were able to give back into people's accounts. They gave them back checks because right, they're a nonprofit. So after all of their expenses, anything left over, they gave back to us as members. You've never heard of that before, but that's why the commercials that you'll never see an Impact commercial. What you saw today is how we do our presentations to employers and individuals and families. So the overhead of marketing, all of that is cut out.
Okay, gotcha. So it's just more streamlined that way. So
Yes.
you're not seeing, TV commercials and things like that. It's more direct, person to person or person to business or business to business.
There you go.
Understood. Now, if somebody's thinking about doing this, are there any with you or with another? I know there's a lot of groups that do this. Are there any, it feels like it's a newer concept. Are there any red flags to look out for with different health sharing groups? Anything like that as someone's looking to be a really wise consumer?
Right. So with health sharing, period, the difference that sets Impact apart from other health sharing is the technology that we have. It's patented. The technology that we have with cutting the cost of your bill, medical bill, and the cost of seeing your monies every month and how they're distributed, you actually see the families that you're helping. Now, I will say this disclaimer: some of the families, if they want to remain anonymous, you see how much you're contributing, but you don't see the family. But if they don't mind sharing that information of what their expense and why they had to do those expenses, you actually see all of that in your back office that you're given. Every individual is given a back office.
Got
So
it.
everything is transparent.
And I think one of the things that people feel comfortable about with a traditional insurance is that these companies have been around forever, right?
Sure.
Like you maybe had Blue Cross Blue Shield since you were itty bitty baby, and now, you're 50 years old and you've still been covered by them. So every time you may have to fight for your claims, but you always get paid on it, and it's been around for decades and decades. What do you say to somebody who says, that seems much more reliable than a health sharing plan? I don't know how long this is going to be around, or if it's going to stay in business, that sort of thing.
Absolutely. I would say, who would have thought that you would be at the airport, did not rent a car, and you would call an Uber? You would ride in someone else's car or stay at someone else's home. I would say the same thing. The industry itself has always had a disruptor. We are Impact Health Sharing, and we will be the disruptor in the insurance market. Federal Express, UPS, Amazon are all disruptors in their industry, and the history shows it. People were afraid, but what did we do during COVID? I had so many Amazon boxes delivered to my home, it was crazy every day. So it's always that I'm scared, but when I can save a family hundreds of dollars a month, that changes their lives. I had a family of 6, changed their life. They can afford things now. The peace of mind that you're getting the same and better coverage and paying less. That's the disruptor. Yeah, it is change, but change will come about.
Jackie, thank you so much. So you guys, her website is actually in the chat right now. So is her email address if you wanted to reach out and just ask some questions, do your due diligence, that sort of thing. And Jackie's actually going to be back with us next week. So thank you so much for today's presentation, Jackie. I really appreciate you.
Thank you so much. Great questions, Jenny.
Thank you. I really enjoyed our conversation. So just a little tease ahead to the topic next time. I mentioned it earlier. We are going to be going into leveraging advanced payment processing, business internet for small businesses, that sort of thing. And Jackie's going to do a deep dive on that. So that's coming up next week. And the replay for this session is going to be up on SARE National's YouTube channel by Wednesday. So 6 days from today, it will be up. If you wanted to go get, a review, kind of rewind back through, get answers to your questions and that sort of thing. But we look forward to next week's session as well. And we can look forward to the conference. I know Jenny won't stop talking about this conference, but it's just because it's so good. 60 years of service, employment, redevelopment at the Irving Convention Center in Las Colinas. So that's in North Texas. I know that you all are watching from all over the country, but a lot of you do happen to be in North Texas or in neighboring states. So we would love to see you there. It is actually free, and you can register on the SARE National website, which is probably the same website you went to register for this session. So we are looking forward to that. And also, SARE STEM Day. This has a special day in my heart. It's an online event, so you don't even as much as we want you to come here to North Texas, you don't have to, because this one is a virtual event. It's from 11 to 2 Central Standard Time on April 5th. And the guest speaker is actually Jose Hernandez, who's a former NASA astronaut. So talk about STEM. He's kind of the go-to, kind of an icon and a role model in the STEM world. And that's going to be a great day of education. They do prizes and giveaways, and it's just really fun and lighthearted. So looking forward to all of that. If you have any questions at all, it is on the SARE National website. And I will see you back here next week. Same time, same place. Bye-bye, everybody.
Bye-bye.